Next ligament, ligamentum flavum. Ligamentum flavum, it is a thick ligament. It is a thick ligament present over the, it is a thick ligament present over the posterior surface of the spinal canal, posterior surface of the spinal canal. Okay, so we'll see here where it is the posterior surface of the spinal canal means, suppose if we take, this is our body of the vertebra, here we'll be having spinal canal, spinous process, transverse process. Okay, so this is anterior longitudinal ligament, here anterior longitudinal ligament, here this is posterior longitudinal ligament. So if this is spinal canal, so here anterior longitudinal ligament is there, so that means this is anterior, this is posterior, so it is a ligament flavum is a thick ligament present posterior surface of the spinal canal. So ligament can mean ligamentum flavum will be here, this is ligamentum flavum, thick and posterior surface of the spinal canal, so this is ligamentum flavum. Okay, so the fibers of these ligamentum flavum will extend from second cervical vertebra to the sacrum, and at the same time it is going to this ligamentum flavum, ligament is going to connect the it is going to cover the lamina of all vertebrae. So lamina we know, if we take body, so here we will be having first one pedicle, this is the pedicle, then this is our transverse process and this is our spinous process. So between transverse and spinous process, so this is the lamina, so the ligament flavum will be present here, it is going to cover the laminas of the vertebrae. And some fibers of this ligamentum flavum is going to cover the lamina. Okay, it's clear, lamina, and at the same time it is going to cover the joint capsules of the facet joints, we discussed already. So if this is spinous process, so this is transverse process, this is pedicle, and this is the body of the vertebra. So here we'll be having superior articular facets, inferior articular facets. Ligamentum flavum will be present here, it is going to cover the lamina, of the vertebra. At the same time it is going to cover the facets of the capsules of the facet joints, giant capsules of the facet joints. Okay, so here next point, same like anterior longitudinal ligament and posterior longitudinal ligament, in this ligamentum flavum also will be having two fibers. First one, superior and deep fibers. Superior and deep fibers will be present here. The superior component of this ligamentum flavum is yellowish structure. Okay, it is light yellow structure, light yellow color structure, and at the same time the thickness of the superior fibers here 2.5 to 3.5 mm. This is the thickness of this superficial. This is the thickness of this superficial fibers of this ligamentum flavum, and it is going to, in this superficial fibers, what it is going to do, it is going to fill the interlaminar space. What is this interlaminar space means? Suppose if we take one vertebra, this is one vertebra, here pedicle, transverse process, lamina, spinous process. Okay, one more vertebra here, for understanding I am saying one more vertebra is there, here this is pedicle, transverse process, lamina, spinous process. Okay, between these two lamina, the space between this lamina and this lamina is nothing but interlaminar space. So the superficial fibers of this ligamentum flavum is going to fill the interlaminar space. So it is going to cover this interlaminar space. So here, for understanding I draw like this. Suppose if we take one body and body IVD. This is the body. So suppose if we take, it is spinous first, this is transverse. So this is the lamina of this vertebra. So this ligamentum flavum is going to fill the interlaminar space of this intervertebral bodies. Okay, next point. Here if you see deep fibers, it is a dark yellow color fibers. The thickness may be around 1 millimeter. So the thickness is 2.5, here thickness may be more, around 1 millimeter. So what it is going to do, it is going to mean here these superficial fibers are going to fill the interlaminar space, but what these deep fibers are going to do, these are going to create soft or smooth surface of the posterior spinal canal. So here if we see intervertebral body, so this here we are having transverse and spinous process, here we are having ligamentum flavum. So what is this deep fibers means? Deep fibers, what it will do is going to create soft and smooth surface of the posterior spinal canal. It is going to create soft and smooth surface for the spinal canal. So what is the use of this means? This soft and smooth surface which is present here, it is going to contact with the dura mater. What is this dura mater? We know coverings of the spinal cord. If you see first one, dura mater, arachnoid matter, and chiasm matter. So outer layer is dura mater. So the soft this ligamentum, what flavum is going to make this posterior soft, so it is going to contact with the dura mater. So these three layers called as meninges, coverings of the central nervous system, meninges. Okay, next point here, the ligament, this ligamentum flavum, it is strongest in the thoracic region. Especially lower thoracic region, the ligament will be very strong. At the same time, it is weakest in the cervical region. Which means mid cervical region. So if we take thoracic spine T1 to T12, if we divide this into three parts, is 1/3, 2/3, and 3/3. Okay, 3/3 or lower third. Okay, so in this lower thoracic region, see in this lower third, the ligamentum flavum will be very strong, and weakest in the cervical region, mid cervical region. If we take cervical spine C1 to C7, if we divide it into 1/3, 2/3 and lower third, so in this mid cervical region, this ligamentum flavum will be very weak. This ligamentum flavum will be very weak. Okay, if we do flexion, if after that if we do flexion, in this flexion movement, the ligament will stretch. If we do vertebral column, means suppose one vertebra is there, if we do flexion, this is anterior, this is posterior. If we do flexion movement, the ligament will be stretching. The ligament will stretch. Okay, even though it is stretching in flexion, if we do extension, the ligament will be like loose. The ligament will be like, even though it is stretching in flexion position, if you are in extension or if you are in neutral, if the patient is in neutral means that means no movement also, the ligament will be always a constant tension. It will maintain a constant tension always. So because of this constant tension in this ligamentum flavum, see here we are having, so here ligamentum flavum, because of this constant tension, of this ligamentum flavum, it is going to create a compression force. It is going to create a compressive stress. It is going to create a compressive stress on the disc. It is going to create a compressive stress on the disc always. So because of that compressive stress, because of that compressive force on the disc, always, which is going to create, it is going to increase or maintain the intradiscal pressure remain constant or high. So here the point is, because here the point is, because of the constant tension in the ligamentum flavum, it is going to give compressive force to the intervertebral disc. Because of that intervertebral disc compressive force, the intradiscal pressure, which is created by this ligamentum flavum, will be high, so that the disc will be maintaining intradiscal pressure will be always high. So what is the use of this high intradiscal pressure means? Of this high intradiscal pressure, the shape of the ligament will be maintained. The shape of the disc will be maintained like stiff. So because of this intervertebral disc stiff shape, so it is going to resist, it is going to prevent the bodies. This is body of the vertebra, this is also body of the vertebra. Because of this high intradiscal pressure, the pressure which is created inside the disc, so the disc is going to be stiff in this structure. So because of the stiffness of that intervertebral disc, it is going to maintain the compression forces or distraction forces between the bodies of the vertebra. So this is about ligamentum flavum. Okay.